My name is Baba. I'm representing addiction. The problem of addiction has gotten to a crisis level, even to alarming rate in US. And there's need for every one of us to come together to solve the problem of addiction. There's no locality that is left out from this crisis. Both urban centers and rural centers are affected equally. And this is why our slogan is together we can solve or overcome addiction. Because everyone needs to come together to solve this problem. The individuals involved, they are not able to solve this problem on their own. The centers that are providing services are not able to solve this problem with the client alone. So therefore, everyone is needed. The community is needed. All stakeholders is needed. And the individuals and the families are needed to come together to solve the problem of addiction in the United States. Right now, as you can see from our first slide, there's a road. Addiction is a habit. When people begin to take the habits of using drugs, illicit drugs. And from the first slide, you see that there's a road, old habit that leads to a bad road, to a road where there's a pain. A road that leads to struggles with addiction. A road that leads to nowhere but to pain and sorrow. But you can see after treatment, there's a road that leads to straight recovery. So therefore, as a practice, we want to provide hope for the hopeless and be able to recover from addiction. What are the problems that we have discovered that we want to solve? The major problem is addiction. And we need to tackle it and solve this problem. This is why we want to be in business to provide services. Number two, many of the guys involved that have been affected by addiction, they do not have access to services because they live in rural areas, especially those in rural areas. So they don't have access. As a practice, we want to provide services. We have to meet them at homes and provide services for them. Many of them don't have transportation. They can't come to centers because they do not have means of transportation. This is why we're going to be providing services that requires telepsychiatry, so that we can meet these guys in their homes and provide services for them. Some of these guys, they lack the knowledge and understanding of the dangers of addiction and how they can come to overcome it. So we're going to be providing services to make sure that they understand what it is and how they can come or overcome addiction. And some of the solutions that we have that we want to use to solve the problem is providing Suboxone, which is a type of medicine that will help the individuals involved to stop craving for drugs of abuse. And number two, we're going to be providing Narcan that can help them with overdose, that will prevent death. Number three, we're going to be providing counseling services so that this guy can gain skill that is needed for them to recover from the addiction. Positive coping skill, so that they can change their bad habit to good habits. We're also going to be providing telepsychiatric, so that guys who are living in remote areas can have access to services They don't have to travel thousands of miles, or I mean, miles and miles to get to where they have access to service. So we'll be meeting them at their homes and providing services for them. We also will be meeting those people that have child care problem in their home through telepsychiatry, so that they don't have to abandon their children while they are trying to deal with the problem of addiction. This is what some of the solutions we want to provide to overcome the problem that we have, helping guys to overcome the problem that they have with addiction. I want to let one of our team members, Jean, to present the next slide.
Well, the next questions, after hearing about problems in substance abuse as well as some solution is, well, why now? Why is substance abuse a major problem now? If you have watched any news recently or read any news feed recently, you certainly heard about substance abuse and overdose and public safety issues involving substances. Currently, the CDC estimates that there are about 52,000 deaths annually due to substance abuse. Overdose rates are especially higher in rural area, at about 50% higher than in urban settings. And females in rural areas also tend to have a much higher rate of drug overdose death than their counterpart in urban settings. So this is all to say that the opioid epidemic is very much true. And it's not just an opioid problem. There is an alcohol problem. There is a heroin problem, especially in rural settings. There is, PCP problem. Just about every substance of abuse, whether illicit or prescription drugs, have been, in the headlines recently, causing deaths, overdose, and damaging communities at large. So the next question is about getting customers. How are we as a business, how does Healthy Habit Rehabilitation Center intend to get customers? Well, first of all, there are about 19 million individuals suffering from substance use disorder in America. And the estimates by the CDC is that about 38% of adults battle an illicit drug use disorder. And to take that even further, about 12% of people aged 12 and up report an illicit drug used in the past month. So this is a chronic problem that affects not only adults, but even teenagers or even preteens. It's important to note that about 74% of adults suffering from substance abuse disorder particularly struggle with alcohol use disorder. So yes, alcohol, it's not an opioid necessarily, it's not an illicit substance necessarily, but it is the main abused substance amongst pretty much the various substances. We are going to appeal to customers using our hybrid model, which is going to involve a brick and mortar location, particularly in rural settings where there's a real lack of access to substance abuse treatment, in addition to a telepsychiatry service which would bring counseling to patients wherever they are, wherever they may be, or whenever they need us. One important statistic to mention is that there are about 58.7 opioid prescriptions per 100 people in the USA. This number is an important figure in the sense that studies reveal that most people with substance abuse issues start after using an opioid prescription or a legal substance. For instance, you fell, you broke your back, you start taking oxycodone for pain, and a couple months later, people have a hard time stopping that prescription, and things spiral out of control from there to lead to substance abuse. Now that we have discussed getting our customers, we are going to talk why us, why Healthy Habits Rehabilitation Center versus other substance abuse treatment facilities. While other substance abuse treatment facilities are traditional in the sense that patients have to report to the facility for counseling, for prescriptions, and these facilities are typically only available during traditional business hours, 8 to 5, 9 to 6, and they are mostly located in major cities and urban areas. When looking into substance abuse issues, it does not just affect people in urban settings. It is very much a problem, especially in rural areas. And in these areas, there is a real lack of services. There's a real lack of clinics. So these patients are having to commute long hours to get to clinics. What we are going to provide is a combination of a brick and mortar store to assist with access to care and provide telepsychiatry for counseling. So we would be able to be closer to every patient, meet our patients wherever they are, and be available anytime that our patients need us. We will also work with local communities, local jails, for instance, or local safety net clinics to provide substance abuse treatment wherever the need may be.
So you've heard about the problem that we're facing. You've also been told about the solution, something that we're trying to offer using our hybrid model, going away from that traditional brick and mortar model, but incorporating that into a electronic digital model that includes telepsychiatry. But let's talk a little bit more about us. Jeannie mentioned, why you should go with us, but now you should know a little bit more about us as individuals and the different people that we're trying to get on our team. First, I want to introduce, again, Jeannie Mufuku, who is a nurse practitioner, and she'll be leading up that side of things, the medical side of, medical or clinical side of things. Next, Babatunde Akieme is also a nurse practitioner, but he specializes in substance abuse issues. He's been working in that for a number of years, and that's where his specialty lies. My name is Stephen Walker, and I am a business person, but I have a technical background, so I'm playing a little bit of two fiddles here as a technical expert as well as our business person to start things off with. So we have 3 founding members, but we also want to surround ourselves with a bunch of more people. Some of those people include 6 counselors currently that we're talking about, possibly social workers, psychologists, or even mental health workers to come alongside us and to help with this issue that we're trying to eradicate. We also want to get 2 medical assistants that will be able to help Jenny out a little bit more so with her side of things in the clinical aspect. We also want to get 1 mental health nurse practitioner to come in to, again, help out with Baba on those side of things and to really be able to just kind of fit into these different areas that may or may not be fully thought through yet. Now we want to transition also to the people who are not in the medical field, at least not the traditional portion of the medical field, we're looking at one lawyer and one CPA, or one, I guess, accounting firm, to make sure that we're solid on our business side of things, not only in legal matters, but then also in our financial matters. So we want to take a look at those two people, and if we can get a full firm, great. But again, these are just initial numbers based off of this one hybrid location, the small brick and mortar store in rural Kansas. So that's the first big step we want to make with these people. So you've heard our vision, you've heard the solution, and now you've heard a little bit more about us. But let's talk a little bit about dollars and cents. Let's talk about money, because I think that's what you're really interested in. And the first thing I want to talk about in this financial information slide is the net income. We have 3 years here of year-end summaries, and I think the first thing that you really notice is that every year over year, at least for the first 3 years, our numbers continue to grow, going from 143,000 to 515,000 in year 3. Now, the thing you have to realize is that these are conservative numbers, and what I mean by that is that this is just for one brick and mortar location. Granted, again, we are a hybrid business using our brick and mortar location, but also bringing alongside the telepsychiatry. So we have one location in western Kansas, a rural location, that's generating these numbers. But now just think about the possibilities once we start opening this up to larger areas. So again, this won't just happen to have to work in a smaller rural community. This can also go into a large urban area and still work. So we're talking places like Baltimore, Maryland, Orlando, Florida, LA, California. I mean, you're talking these large areas that this model still works for, but can also still work in smaller areas. So as this being a pilot location, these numbers speak volumes. Finally, I want to talk to you about 4 areas that we are very excited about. Those key areas are the net profit margin, which you saw in the previous slide, the break-even levels, the current ratio, and the quick ratio. Now again, these are coming into you as conservative numbers from this one pilot store. So because of that, the sky is the limit with the potential. So again, looking at the net profit margin year over year, we have 16% all the way up to 36%. So from year 1 to year 3, we'd have a pretty big jump. And again, from one location in rural area. Our break-even levels, again, good number, solid number, $211,000 for us to finally break even and start making a profit. But based off of our calculations off of these 4 service areas, that should come within the first year. Another thing that we're looking at is our current ratio. And again, the current ratio is just the financial strength that we have in this company. And year over year, we have some explosive numbers. So the first year is 1.38. Year 2, 2.73, and finally in year 3, 5.38. So if we think about this again, for just this one location in rural Kansas, those are numbers that I think any of us could be quite excited to see. Finally, we take a look at the quick ratio, and that measures our short-term liquidity and basically how able we are to repay our debts. And again, following the current ratio, it goes from 1.21 all the way to 5.37 in year 3. So the sky, like I said, I cannot reiterate this, but the sky is definitely the limit when it comes to the amount of money that we could be making from this venture. So, there's some interesting things we're going to have to do there with insurances and getting money in, but once the money starts coming in, sky's the limit. Let's just put it that way. So we are excited. I'm excited, and I think you should be excited. So with that, we just want to make sure that you are well aware that we'd love to continue talks with you, love to keep picking your brain and finding out a little bit more about what you think of our venture. But then one of the things that we'd really love to talk to you about and even ask you right now is if you would be prepared, based off of this, to consider becoming an initial investor in our company. Now, we know there's a lot more we have to do, but becoming an initial investor right now puts you at the forefront of helping us stem this epidemic and helping us turn the tide to make things a lot better for a lot of addicts out there. Again, thank you for your time. We really appreciate things, and we will be in touch.